All right, how you doing? Thanks for taking my call. I appreciate it.
All right, Mike, what's
Um,
what's going?
Last year I got diagnosed with Apollo Flabias. I spent a week in the hospital.
All right.
They ran a whole bunch of tests, CAT scans, MRIs, blood tests, and they found nothing was wrong with me. But I was going blind in my left eye. My left eye was swelling up
All right.
and starting to detach from my optic nerve. They had to hit me with a steroid shot to bring down the swelling,
All right.
but then that was only the symptom. Um, a year after that, just recently, 3 months ago, it started up again. They told me that it would never happen again, that it was a freak accident. But nonetheless, it happened again 3 months ago. But this time, it was a little bit slower.
Okay. Did you now when you developed this, did your eyeball bulge at all?
No,
Oh, you'd know it if it did. Okay. So in other words, like you didn't end up with a facial asymmetry where the eye was like pushing its way outward.
no
Okay.
balls.
Did they do an MRI or CAT scan of your head?
Yes,
Okay. What did they find?
they test for negative for anything.
Okay. Did they look for cavernous sinus issues? Okay. There's a big like a venous pool. Okay, near the center of the brain, and when this thing starts to back up, sometimes you can end up seeing intraocular pressure go up. Okay, now I'm going to try to get to this, but we're going to hold you through the break because this is kind of an interesting problem. Okay, so Mike. Okay, so
Yes, sir.
what I was looking at basically was something along, basically a vascular issue. So how much of your eyesight have you lost thus far?
Right now, it returned completely, almost completely back to normal.
Congratulations. Okay, so you had temporary
when it
blindness. Okay.
when it happened,
Mhm.
I lost complete central vision. There was a big black spot, a big gray spot in the middle of my left eye. I couldn't see anything.
Okay, so you couldn't read in particular, but you could see light.
Yes, I could see light. There was light coming in, but I couldn't see any details whatsoever.
Okay, so
No colors.
temporary foveal loss. Okay, I mean, it sounds to me like it was a vasculitis. What did they tell you?
They told me that they said I was 100% healthy. They
Okay, that's
said that.
nonsense. Okay, yeah, that's easy to tell somebody when you don't know what happened. Okay, so
Right.
so basically, you lost foveal vision for some period of time. It came back, and they're telling you, oh, don't worry about it. It's going to be just fine.
Right.
I would be
Right.
more inclined to investigate a little bit more. Did they do any blood work on you? Something that might sound like a CRP or a SED rate?
I know they did a whole bunch of blood tests and
Okay, you can do a lot of blood tests and not do the right thing. Okay, what
right.
you need to do is you need to ask them to do this. And this may be very much more important than I can emphasize. They need to check you out for autoimmune disease, mixed autoimmune disease. Okay,
Okay.
because sometimes you can end up with either what's called mononeuritis multiplex. This is where you end up with inflammation of a particular nerve, optic nerve maybe. Okay, but you can end up with vasculitis as a result of these things. So what you need to do is have them screen you for autoimmune. A thyroid disease in particular, that's probably the most common. They need to do something called an ANA and an AMA. And what you're looking for these mixed autoimmune disorders. Okay, if this is the case, then you'd better get ready for the next bout of this. Okay, because just because just because you bounced off the bottom and didn't suffer any damage doesn't mean that you're not going to bounce the next time and break. But this sounds to me like an autoimmune disorder, and most likely is going to be a vasculopathy. Okay, does that make sense, Mike? It's kind of an interesting problem, but it's I would take this one real seriously, and I don't think I would blow it off if I were you.
Okay.
You got it?
Yes, sir.
All righty, my friend. You be
All
well,
right.
and that's got me a little bit concerned.